Good afternoon and welcome to the Multicultural Media Conference online this June 12th, 2024. And hello and welcome to all of you for joining us. This session is hosted by the Ministry of Health, Multicultural Health Communication Service, and the support of Multicultural New South Wales. I am your moderator for these sessions. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service. And we're pleased to have with us joining today Dr. Darren Roberts, Medical Director of the New South Wales Poisons Information Centre at the Children's Hospital Westmead. And welcome back, Darren. It's good to have you with us again.
Thank you, Jess. Great to be here.
Good to have you. And we have joining us today also a very important person to talk about the topics that we have today. Superintendent Gary White, Manager in Community Safety, Fire and Rescue New South Wales. Gary, thank you so much for joining us today.
Thanks, Jess. Great to be here.
Today's topic is very important this winter season, and we can all feel that it's getting cold: carbon monoxide poisoning and winter fire safety. And we want to remind everyone about the importance of keeping ourselves and our families and our homes safe. So with winter now here, we want to remind the community of the risk of carbon monoxide poisoning and how we can be fire safe over these cooling months. Before we begin, I would like to acknowledge the traditional owners of the land and custodians of the land on which we are all meeting from today. I am joining you from the land of the Darug people, and Darren is joining you from the Camaragal people of the Eora Nation. We pay our respects to elders, past and present, and extend that respect to Aboriginal elders and colleagues. And we also acknowledge the elders and leaders from all multicultural groups and refugee communities represented in this session today. And so now we'd like to start with the important question of the day. Dr. Darren Roberts, as the days and nights get colder, we typically spend more time indoors. So the risk of carbon monoxide poisoning increases. Could you tell us a bit more about carbon monoxide?
Sure. So carbon monoxide is a gas. It's a dangerous gas, and it's actually a gas that can kill you. Where it comes from is when people are burning things, and they can be burning almost anything, and the burning doesn't occur completely. Carbon monoxide is produced. So there are many ways that people can be exposed to carbon monoxide. It's a very dangerous gas for a number of reasons. It has no smell, it has no colour, no odour, you don't know, no taste, you don't know that it's present. So carbon monoxide can be filling up in the room, and the people who are there don't know that it's there. This is one of the reasons why people call it a silent or a deadly killer, because people are at risk are getting poisoned and they don't know. You mentioned we get carbon monoxide poisoning in New South Wales all year round. Every case of carbon monoxide poisoning is preventable, but winter we worry the most because we see at the Poison Centre an increase in the number of cases. And this also occurs in hospitals as well. Always around this time, we start to see more people coming to hospital because of carbon monoxide poisoning. And every case is preventable. And it largely relates to the fact that they've brought devices inside, burning devices, which are meant to be outside, whether it be burning devices such as briquettes or wood or gas.
And Darren, it really is interesting because a lot of people still don't know what carbon monoxide is. And when they hear it, people just don't know. And I guess that's why we're here to inform, and that there are resources available.
That's exactly right. Some people know about carbon monoxide. For example, they associate it with cars, particularly the older cars. We used to talk about how they let off a lot of carbon monoxide. And some people who work in certain jobs know that carbon monoxide can come off devices. We still see poisonings from that. But a lot of people don't realise the risk that they can come to from carbon monoxide poisoning when they're trying to keep themselves and their family warm. It's a well-meaning act. Sometimes people make a decision to bring a heating device inside because they're cold, they're celebrating something lovely with the family, but it can lead to tragedy and terrible outcomes.
Thank you, Darren. And Gary is a superintendent with over 35 years of firefighting experience. What have you seen firsthand around the incidence of carbon monoxide poisoning?
Yes, thanks. I guess this occurs every winter, and as Darren mentioned, all throughout the year, where we end up with people who are unfortunately have tried to keep warm. Last year in July, we had an incident out at Marylands where there were 6 people, 2 adults, 4 kids, who very nearly lost their lives, and that was due to the only thing that saved them at that point in time was one of the occupants woke up feeling a bit ill, and that was enough for them to alert the others that something wasn't right. And unfortunately, 3 months or straight after that, there was another one where firefighters actually went to an incident in Maryland and managed to actually drag 3 people out. So it's one of those, as Dr. Roberts has mentioned, that it's that silent, it's no odor, it's invisible, and that then sneaks up on you without knowing. And I guess that's one of the big challenges of it. And particularly if people are bringing outdoor heating devices or outdoor cookers that have got charcoal beads or gas inside, that allows that build-up of carbon monoxide in the house, and you then don't realise that it's actually building up, and as it starts to affect you. So that's why our prime recommendation is that you protect yourself by making sure you got your barbecues outside, that you got your outdoor heaters stay outside, so that you don't have that build up of carbon monoxide, and we don't have fatalities come this winter.
Thank you very much, Gary. And I guess what's important is noting that there are ways to know and understanding that there are common symptoms of carbon monoxide. Darren, what are the early signs of carbon monoxide poisoning?
Right, that there are symptoms that some people experience, but sometimes they can be so non-specific or vague that people might put it down to something else. So people should be careful. So some of the main symptoms that we hear about or that we know exist with carbon monoxide poisoning are basic things such as nausea or vomiting. People can get headaches as well. And these are all early signs of poisoning. And so to me, these would be signs of being very concerned. So if someone's brought a heating device in and these things occur, be concerned that there could be poisoning. But if they progress to things like headaches or dizziness, or particularly if there's a loss of consciousness or difficulty waking someone, these are potentially life-threatening, life-concerning side effects or markers of carbon monoxide poisoning, and people should get help. They should open the door, let the carbon monoxide out, and they should get help. The best way to get help is if someone's particularly sick, like I mentioned before, they're unconscious or dizzy and falling over, it's just called 000. Get an ambulance there immediately. But if you've got a bunch of symptoms, you're not quite sure what they are, is it poisoning, is it not? You can always call the Poisons Centre on 13 11 26, 24 hours a day, 7 days a week, and people will be there to be able to answer questions and to be able to provide some advice, information to you about your particular situation. And whether or not you need to get help. But if people are experiencing these symptoms, it's very important to open the door and the windows and to get the carbon monoxide out. And of course, take that heating device outside.
Thank you very much, Dr. Darren. And, I think what's important to note as well, that a lot of people who are online today, you might have had experiences, or if you've heard anything and you have any questions, please let us know. And Dr. Darren and Gary would be able to provide some of those answers for you. And Gary, why is carbon monoxide safety particularly important for multicultural communities and communities across New South Wales?
Yeah, I guess carbon monoxide poisoning can affect anyone. And to reinforce that, one of our firefighters was at home doing a bit of work in his garage. He was in a unit, so he was in the garage underneath. Unbeknownst to him, there was someone doing some carpet cleaning, and they had their carpet cleaner downstairs, which was run off an internal combustion motor. He started to feel dizzy. He started to feel not well. He thought, "Oh, what will I do? I'll walk up outside." And that's what saved him. If he'd made that other choice and gone, "I'll just go sit on the bench over there," it may have been a different ending. So it can affect everyone. And I guess that for us, when we're talking about carbon monoxide poisoning, it's to be aware of those things. So be aware of the risk of having barbecues indoors. They're designed to be used outdoors, particularly burning charcoal or having the outdoor heating devices inside. So those nice LPG powered heaters that you see outside at restaurants and everything else, they need ventilation. You need to have them outside so you don't get that build up of carbon monoxide. And unfortunately, each year, and particularly this year, as we're into winter now, that the cost of living, people are looking at ways to keep warm. If you're looking at ways to keep warm, bringing your outdoor heater inside or bringing your barbecue inside isn't a way to keep warm because of the carbon monoxide. It can have, effects on you that will, may lead to you being killed from it. So it's looking at other ways you can use to keep warm rather than bringing that outdoor equipment inside.
I guess the challenge is for some communities, it's cost. And the ones that are outside in those restaurants are expensive. And I guess that's the reason why there could be these accidents. Is that correct, Gary?
True. And it's interesting. We see, exactly like Gary mentioned at the Poisons Centre, we see so many people who get poisoned because they bring in a device simply because they didn't realise that, for example, a lot of people think gas is okay. Burning devices such as charcoal briquettes, they may think that's a problem, but they think gas could be okay. But all of these outdoor devices should remain outdoors. And as Gary mentioned, this is actually a life-threatening condition. This is not just you'll feel a bit sick, maybe be unwell for a day or two. People die, and people can have irreversible damage to their brain. It really is a major concern, which is why it's so great that we've got the opportunity to talk about the risks of this, because it's so easy to occur and can be so devastating for a family.
I'd like to touch on that, Dr. Darren. You did say that it has lifelong effects. For example, if you have had poisoning and you didn't feel anything now and you got recovered, what are those term effects that could cause that people should be aware about?
The main people who suffer from these long-lasting effects are those people who are so severely poisoned that they lose consciousness. That's one of the reasons why I mentioned before that if someone is unconscious or difficult to wake up, call 000. Don't muck around. They need emergency care immediately. That relates to the fact that they haven't had enough oxygen to their brain. And when the brain doesn't get enough oxygen, it gets damaged. And then the brain's not very good at recovering from damage. It can recover in some cases, but not all functions will recover. So this is why we think, if in doubt, if someone has any symptoms, get advice. But particularly if someone is dizzy, falling over, or unconscious and difficult to wake, just call 000.
Thank you so much, Dr. Darren. And if there are any questions that you have, please ask the questions now, because I think this is really important for the community to remember. Now, Gary, we've heard all about carbon monoxide poisoning. Winter is critical, right? What are some of the general tips for the community on how they can be fire safe this winter?
Yes, thanks. Unfortunately, in winter, we get about a 30% increase in fires. And because of that, winter is one of our seasons. So already this year, we've had 4 fatalities due to fires, and winter's only just kicked off in winter. So that's, since the 1st of June, there's unfortunately been 4 fatalities across New South Wales. So our main message is be fire safe. To do that, have a working smoke alarm. And importantly, know what to do when it goes off. So by working smoke alarm, we say test it once a month, press the test button. And from there, if it makes a noise, all good. If it's not, or if you've got any concerns, call your local fire station. We'll come out for a free safety visit. If you invite us into your home, we'll have a look around. And, if there's other things, we'll say, okay, where's your way to get out? Have you got a home fire escape plan? Is that really a good idea to be charging that e-scooter between yourself and the exit? Because if it catches fire, how do you get out? So we'll talk through all those things with you. If you don't have a working smoke alarm, we'll install one for free. So it's a really great program to be able to access it. Call your local fire station or jump on our website and have a look. But yeah, safety visits are good in that aspect to help prepare you for being fire safe during winter.
I think that's really important, and it's great to say that here, that nobody probably knew that you could go and ask the fire that you could get your own fire safety alarm installed for your home. And sometimes a lot of people may not know how to install it correctly. That could be possible, Gary, that sometimes this could be caused because it's no one, the battery's not being checked, but also it's improperly installed.
Absolutely. And that's the beauty of having us come out and have a look through for you. We'll provide those fire safety tips specific to your home, but also we'll check your smoke alarms. And if you've got one that doesn't work, we'll put a couple more up so that you're good to go. If they need an electrician to come out later, we'll put one up anyway so that it's there, so you got protection until you can get an electrician come out and fix your hardwired smoke alarms.
This may be a silly question. How many alarms should you have in your home?
You should have at least one on every level of your home and at least one between your bedroom and your exit, or in the bedroom and your living area. But what we recommend is that you have an interconnected smoke alarm, which means that if one alarm goes off, they all go up, and you have them fitted in each of your bedrooms and each of your living spaces. Now, the other important bit about that is that we also have available smoke alarms for deaf or hard of hearing people, where they have a flashing strobe light and a vibrating pad that goes underneath the pillow. So you can access those through either your NDIS or through your My Aged Care, or if you can't get it through that, we'll also supply one for you. So there's all these different options out there to help you be fire safe. And the very first line of defense for that is having a working smoke alarm, and importantly, knowing what to do when it goes off.
Well, that's really important. And I wanted to ask you, Dr. Darren and Gary, an escape plan. What is the best escape plan? How do you do that? And I think be organizing that in advance and for your family is important.
That one to Gary.
Yes, and so when you're at home, think about, if I'm in this room and there's a fire occurs, how am I getting out? If that fire occurs between myself and the exit, as in your front door you walk through, what's my alternative? Do I have a second option? Is it out through the window or is it out through the back door? So firefighters are really bad like this. We go into places and always look around to see where our exits are. So, when we go visit someone, or you go out of a night, we're always looking for the exits and trying not to have anything that's going to be involved in the fire between ourselves and exits. And that's why with lithium-ion batteries, you'll hear us talking more and more about lithium-ion batteries now, and making sure that if you're charging something like an e-bike or an e-scooter, it's not being charged between yourself and the exit, and you're not charging it when you're asleep or when you're not at home.
I guess for me, I mean, when it comes to carbon monoxide, and that's fire, and I totally understand that, how important it may be different, because when you're at home, it's different when you're at the office. A fire warden is assigned and you know where to go. And this is, should you be doing that as well at your own house where you assign someone to take you?
Absolutely. So we've got resources for you on our website, and it's about, with your home fire escape plan, it's everyone in the family knowing if there's a fire, how we're getting out, how we're accounting for everyone, but importantly also where our safe meeting point is. For firefighters, when we arrive at a fire at someone's house, unfortunately, and we've got everyone out the front who then meets us and says, hey, everyone's out of the house, that really improves our day immensely, because then we're not having to commit firefighters inside the building to do a search to try and find where everyone is and then rescue them. That's why prevention for us and education like this forum is so important. Working smoke alarm, know your fire escape plan, and have a safe meeting place. Importantly, call 000, get out, stay out. Don't run back in to get your dog. Don't run back in to get something else. The most important thing is you being outside, meeting the firefighters, and knowing that everyone else in your family is outside and safe.
Thank you very much, Gary. That's really important information, and I think that's really useful for everyone. Now, Dr. Darren, in terms of carbon monoxide, and you keep harping on this, and it's really important that when there's a fire, you know exactly that there's a fire and you need to run. With carbon monoxide, it's just the silent killer.
Correct. And that's why we need to be careful and aware of all the other possible causes of how people can get carbon monoxide poisoning. We've spoken about the barbecues with the wood and the briquettes. the gas heaters that are intended to be outside should never be brought inside. But even heating devices that are designed for the house, gas heaters that aren't properly maintained, can also produce carbon monoxide. We've had some people with carbon monoxide poisoning in a house where they haven't been getting regular attention to their indoor heater. And so it's important for people to remember that those also need to be addressed. I don't know if Gary's got any recommendations on that for people who own a house or even are renting a house, but this is also very important.
Thank you very much, Dr. Darren. We have a question here for Gary. Do fire alarms cause fire themselves? If so, what can we do about it?
We've got no instances that we're aware of where a smoke alarm has actually caused the fire. The benefits of having a smoke alarm within your home far outweigh the risk of it causing a fire. It's a small battery operated device, just like your mobile phone, essentially, that sits on the ceiling. So yeah, we haven't had any that we're aware of that have caused fires, but having that working smoke alarm is that first line of defense. It's like putting on your seatbelt when you jump into a car and go for a drive.
Now, Gary, I was just thinking about a fire alarm. Are there new technology to fire alarms where it starts talking, get out now, or things like that with AI? Is that coming soon, or that it's okay? The regular fire alarm is still safe.
Yeah, the tone that it makes, the noise that it makes, it's there to alert you. And the important thing is, and that's why we recommend interconnected alarms, because that smoke alarm going off may be in your living room and you're in your bedroom with your door closed. It's going to be harder for you to hear something if you're in your bedroom with your door closed, as opposed to an interconnected alarm where that one goes off in the living room and all the other smoke alarms go off in the house, including that one that's in your bedroom.
That's really important, isn't it? Because you think you have one fire alarm in your room, but if it's not connected, then individuals are still going to be unsafe in the house.
Yeah. And when everyone goes home after this tonight and tests their smoke alarm, listen to how it sounds and where it sounds, and then think, actually, you know what? I need to get another one so I can hear it in all parts of my, and I need to be interconnected so I can hear it in all parts of my house.
Well, thank you very much, Gary, for that. There's a question here by Basuda, Dr. Darren. How can pregnant women and parents of young children recognize if their symptoms are related to carbon monoxide exposure versus typical pregnancy or childhood ailments? Great question.
It can be very tricky because, as I mentioned before, these symptoms can look like lots of things. So if it relates to, in particular, if it seems to come on around the same time that a heating device is inside, either an outdoor device is brought inside or you turn on a heater that's already inside the house. For example, I mentioned about gas heaters in houses, and you start to get symptoms, then I think it's always best to assume it could be carbon monoxide poisoning. Call the Poison Centre for some advice. But I agree, it can be tricky, but we just need to be careful. Pregnant women in particular can be very prone and at risk from carbon monoxide. It's a big concern. So pregnant women and children are high risk, and we should be particularly careful.
Thank you, Dr. Darren. I also wanted to ask, because we see a lot of TV shows and cooking shows that they're cooking inside with their hibachi or their cooking instruments. Is that safe?
I don't know what a hibachi is.
Hibachi, it's like a small
charcoal grill.
Yeah.
I recently got one, but I haven't been game to use it because I actually want to use it outside, and I want to put it somewhere where it's going to be okay outside, because I don't want to have it inside because of the carbon monoxide. So again, it's something that burns charcoal. Charcoal, when it burns, gives off carbon monoxide. You don't want to have something that's giving off lots of carbon monoxide in your home.
And the risk is particularly increased when there's any burning device within a small environment where you don't have open doors or open windows. So I think Gary's comments there that he's going to try it and use it outside is what I think everyone should also be considering doing as well. Any burning that occurs inside the house will give people that risk of getting carbon monoxide poisoning, and I just don't think it's worth the risk. Wait till summer to test it out with all the windows open and the doors open.
Thank you very much. And Gary, you got it. Test it outside. And it's one of the questions that would like to find out is about kitchen safety. Gary, especially with fire, I mean, it's in the, you're cooking, there's fire, there's a stove. How can you make sure that you are safe and your family is safe? And what are the precautions you should be taking?
Yeah, look, unfortunately, 50% of our fires start in kitchens. So the main message we give is keep looking when cooking. But now everyone's got their phone in their hands. The side message that we now say is don't get distracted when cooking. So pay attention. You've got something cooking on your stove. So you don't want the oil heating up before you've actually put it in. If by chance the oil catches fire on the stove, do not put water on it. A lot of the people would have seen our great kitchen fire simulator where you throw, as a demonstration, we put a small drop of water into some boiling oil and the fireball goes up past the ceiling height, up to nearly the second level. You don't want that happening in your kitchen because that's the end of your kitchen and then you are getting out. Remember, get out, stay out, call 000. So with 50% of our fires still starting in kitchens, don't get distracted when you're cooking. Pay attention to what's going on and keep looking. And then if it does catch fire, get out, stay out, call 000.
Thank you very much. I mean, you're talking about ovens, right? They're talking about barbecues, and it does cause fire. What are the things that you should have on hand at home to make sure that you are fire safe and that you can make sure that you have all those items safe to keep your family safe?
Yeah, so if you've got a fire blanket and the fire's small enough and you feel confident enough to use that fire blanket to put over the fire if it's on top of the stove, you can also have a dry chemical powder extinguisher, a small one. You see them in hardware shops and the like. Same thing, use that. So if you think it's safe for you to use that, if the fire gets too big, get out, stay out, call 000.
Thank you very much, Gary. And Darren, there are a lot of things that are being done now, not noting that we've done this the third year in a row. We're providing as many information and also extending resources in languages. How important is this in your work in terms of reaching communities?
It's so important. It's actually essential. First of all, everyone's at risk of carbon monoxide poisoning, but we do know that there are certain communities that appear to be more at risk based on some of the cases that we've been getting at the Poisons Centre. And it's based on this that we've developed a number of, with of course Ministry of Health, who have led a lot of this work, developed a number of information sheets in a whole range of different languages just to try and help get that message out there to keep everyone safe at home. What we're also learning through over the last couple of years, as we've been looking into this in a lot of detail, is what are the various factors that lead to people getting carbon monoxide poisoning. We've had a lot of discussion today about burning devices that should be outdoors that are brought indoors, causing problems, and that is very important, particularly around this time of the year. We're also learning about other possible causes of poisoning as well. This relates to, for example, Gary was talking before about workmen or other handy people who are using a device, which is a burning device using whether it be petroleum or gas or something similar, incompletely burning, letting off carbon monoxide. We've seen a number of people come into hospitals and contacted the Poison Centre because they were very sick, because they were using a device within an enclosed space rather than, for example, aiming the exhaust out to an open window. We have also seen some people, and I hate to say this, but with high carbon monoxide poisoning levels from shisha. This is also, unfortunately, a risk factor. Too much shisha can also cause problems with carbon monoxide poisoning. We've been seeing it also with some people leaving their car running in the garage with the door closed because it was cold outside. This is also a risk factor for people getting carbon monoxide poisoning. So there's lots of factors that can lead to carbon monoxide poisoning. Please look at some of these information sheets. If in doubt, if you've got funny symptoms and something's been burning or running around you, you can call the Poison Centre for advice, 13 11 26, and we'll be able to provide some information to you. But I can't say it more than enough. If someone's dizzy, falling over, or unconscious, just call 000. This is a life-threatening emergency.
Thank you so much, Dr. Darren. Now, there's another question here before we go. Gary, a question is it dangerous when the boiling pot overfills, the gas stops while it's still on?
It's the same as everything. If the boiling pot overfills, turns it and blows out the flame. If that device hasn't got its auto shut off working, you're then having LPG gas or natural gas go throughout your home. So it's, don't get distracted when cooking. If something happens, turn it straight off.
You're right, because now we're watching a lot of those movies, you know, how to do the recipe well. And so you're watching it while you're cooking instead of really concentrating. So that's really good advice. Thank you. Last words from Darren and Gary. I'll go to you, Darren.
Carbon monoxide poisoning can be prevented. Please just think about yourself and your family in terms of what devices you use and how you use them. But above all, keep burning devices for outside, away from the inside. They should not be used there. The Poisons Centre is always available to provide information, 13 11 26. We have translators as well in the event that that is needed. But if anyone is unconscious, dizzy, or anything else that seems strange, chest pain, anything of concern, just call 000.
Thank you so much, Dr. Darren Roberts, for being with us again here today. And Gary White, thank you so much for joining us. Any last words?
Yes, when you go home or when you finish listening to this, check your smoke alarm. Practice your home fire escape plan. Fire will happen very rapidly and spread very rapidly throughout your house. Get out, stay out, call 000. If you're unsure of stuff, talk to your local fire station, look at our website. We can come do a free home fire safety check. And if you don't have a working smoke alarm, we'll put one up for you as well. So there's all those resources out there, and a lot of them also in language, so they're available, and we share resources across between ourselves and health. So, yep, get out, stay out, call 000. Thank you.
Thank you very much. It's really important information that you've just shared to the community, to the media that's online today, and also to our health workers to share that with the community. Thank you so much, Dr. Dan Roberts and Gary White from Fire and Rescue, for being with us today, and to you online for joining us. And we'll be back in another fortnight for more health messaging to share with the community. But meantime, call 000 when in doubt. If there is an emergency. Stay safe this winter, everyone. Hope you have a good rest of the afternoon. Thank you.